All right, we'll go ahead and get started here. I saw people still logging on here. But good morning and welcome back to part two of our fourth annual Iowa Workforce Health Symposium. I'm Wesley Franklin, the Community Impact Director for the American Heart Association, and I want to thank you all for joining us here today. We have an exciting agenda today to close out our virtual symposium, but a great way to kickstart February since this is Heart Month for the association. For those who missed part one of our presentation on January 19th, featuring our keynote speaker, Ryan Picarella, the recording is available to view on our AHA social media pages at AHA Iowa. A direct link is provided to you in the chat box. So you do not want to miss on a great presentation from our keynote to help set the tone for this year's symposium. So today we will continue to have the opportunity to learn from some amazing leaders within the health and wellness industry that can help support your organization, especially during these challenging times that we are experiencing living in this pandemic. It's a powerful stat to share. 1 in 3 Americans report being worried, and more than half of US adults say that COVID-19 has negatively impacted their mental well-being due to that worry and stress. We need to find ways that we can combat those stats so we can get back to some form of normalcy. So today you will learn about what employers can do to tackle COVID-19 and learn about the impacts on its heart health. And finally, hear about some of the key initiatives that the AHA is looking to address right here in Des Moines. But before we jump in, I want to take this time to thank our exciting presenter sponsors, which are Des Moines University, Grinnell Mutual Reinsurance, Shazam Healthy State Initiative, the Iowa Department of Public Health, and the Department of Kinesiology right at Iowa State University. So please be sure to visit our event page. You will provide a resource link right to the chat box for you to look at after this workshop today. That being said, let's get started. We know COVID-19 has impacted our lives on so many levels, but how is that affecting our heart health going forward? I am honored to introduce our first speaker to speak on this issue, and that is Dr. Rachel Reimer. Dr. Reimer is trained in social psychology with a focus on health behavior from Iowa State University. She joined Des Moines University in 2009 and is an associate professor and the chair of the Departments of Public Health, the Master of Public Health, and Masters of Healthcare Administration. She is interested in the social, environmental, and cultural factors that influence health behaviors. Her recent work has been focused on examining the epigenetic effects of nicotine and alcohol consumption. Dr. Reimer currently serves on the Drake University College of Pharmacy and Health Science Advisory Board, the board of the American College of Healthcare Executives, the Iowa Chapter, and participates in the Association of Schools and Programs of Public Health Leadership Committee. She has served as a peer reviewer for scientific journals, including the Preventative Medicine, Pediatrics, American Journal of Public Health, and Nicotine and Tobacco Research. So please help me welcome Dr. Rachel Reimer to the screen here.
Hello, everyone. Thank you so much for being here today. I'm really pleased to come share with you a little bit about the importance of COVID-19 and heart health, and particularly the role of employers. So thank you so much for that very kind introduction, Mr. Franklin. I really appreciate it. I work here at Des Moines University, which is where, of course, we would all be had COVID not interfered with our plans. So I hope we get to welcome you back to our campus next year for us to continue this work. As Mr. Franklin had said, my work has been, my own personal research has really been focused on tobacco. Some of my earlier work was focused on vaccination behaviors. In general, I'm just really fascinated with how and why people make the health behavior decisions that they make. So I'm really happy to be here with you today to share a little bit about our topic. So for our presentation today, I have my remarks broken down kind of into 3 parts that I hope to spend kind of roughly equal time on. First, I'm going to give you an overview of some of the current public health trends that impact heart health and the risk for cardiovascular disease. The focus here is going to be on health and lifestyle trends that have an impact on our heart health and talk about some of those trends even prior to COVID-19. So I'm going to kind of set the stage of where we were before the pandemic hit. Secondly, I'm going to discuss several of the ways in which the COVID-19 pandemic has been its own risk factor for COVID-19. And I'm mostly going to be speaking about how our lifestyles have changed in response to COVID-19 and how those changes may have increased or decreased our risk for heart health in the future. And finally, I'm going to talk about the unique role that workplaces might play in improving the modifiable risk factors, both within and outside of the work environment. I felt as I was reviewing my remarks, it sounded like I was painting kind of a negative picture of where we were. There's just a lot of risk factors. And so I hope I can leave you with some tangible recommendations and action items that we can all take to improve heart health within our work environment. Okay, so first I'm going to start with the basics. Next slide, please. I am sure you have already heard, but of course I have to kind of start with the basics of that heart disease is the leading cause of death in the United States and worldwide. In the US, approximately 659,000 people die each year from heart disease, and typically this accounts for about a quarter of all deaths. Globally, this equates to about 18 million deaths annually that have some heart disease element or risk to them. To date, the COVID-19 pandemic has killed about 855,000 people in the US and an estimated 5.6 million deaths worldwide. Certainly that is all an undercount, but that's the best data that we have. So factors that place an individual at higher risk for heart disease include, as you probably know, high blood pressure, high blood cholesterol, and smoking, one of my interests. Additionally, we know that diabetes, being overweight or obese, having low levels of physical activity, and excessive alcohol consumption are all also risk factors. And all of these have been impacted by COVID-19. And the reason why it's important to review the morbidity and mortality risks for heart disease is because while communicable diseases, such as COVID-19, represent significant public health interest, it is very much the case that chronic diseases are still a great risk. And I'm going to talk more about the specific behavioral risk factors associated with heart disease momentarily, but I first want to talk about how the most significant communicable disease outbreak of our lifetime has potentially impacted heart health. Slide 3. So how did COVID-19 impact heart health, right? So the full and long-term effects of this COVID-19 pandemic will not be known we're going to be looking at this for a long time, right? We're going to be dissecting the effects for some time to come, but we already have some clues. So the novel coronavirus outbreak disrupted life globally in numerous ways. From a healthcare and population health perspective, it also disrupted the delivery of healthcare services, including the ongoing treatment and diagnosis of new conditions. This is important because we know that while cardiovascular disease risk remains the leading cause of morbidity and mortality, we also know that there have been significant gains in life expectancy and quality of life in the recent decades that require us to pay close attention to it. And it's possible that by stopping the healthcare delivery services and sort of change in our focus in public health, that we may have left the chronic disease conditions more vulnerable to negative impacts. So we also know that with cardiovascular disease risk or heart health, that the outcomes can be significantly improved and possibly even reversed with early diagnosis and evidence-based treatments. But a recent review of the global rate of cardiovascular diagnosis showed that the initial global response to COVID-19 was associated with a significant reduction in cardiovascular disease procedures. In the short term, this was approximately a 65% reduction in testing and diagnosis of these conditions. This was a short-term drop, and in some places it bounced back, but it was really an important and dramatic disruption to the ongoing healthcare of this condition. And we all know that a delayed diagnosis has the potential to hasten premature morbidity and mortality for millions. So this is really important, a really important impact. So moving on to the next slide. So now that we've sort of established that cardiovascular disease risk remains an important priority, even during the pandemic, I want to turn my attention to factors that contribute to your heart health risk. My goal here is to review some new information and maybe even challenge some assumptions you might have heard. On the slide, I have a list of many of the risk factors associated with heart disease. This is not exhaustive, of course, but it includes some. And the ones that are bolded of nutrition, physical activity, mental health, and sleep are where I'm going to focus my remarks today. But you'll notice I touch on other things such as smoking and overweight and obesity. Inflammation is an important topic. And I'm not going to dive deeply into all of those topics, but the 4 that I have bolded on the slide here are where I'm going to focus my time. So I stated earlier in my talk that diet and nutrition are important risk factors for heart disease. And everyone knows we should eat healthy, right? Everybody can tell you we're supposed to eat healthy, but there's not a lot of agreement, at least in the general population, of what constitutes healthy eating. So I'm going to speak a little bit about that. And, our next speaker has some background in that. But at the population level, we know that only 1 in 10 Americans eat the recommended number of fruits and vegetable servings per day. I try really hard to hit that mark. Like I think about this more than I should probably. And I'm not sure I get the full number of servings every day, even though I'm really trying. We also know that the majority of Americans are largely sedentary. One large-scale study that asked folks to wear heart rate monitors to measure physical activity and energy expenditures revealed that on average, the typical adult engages in about 5.5 hours of light activity a day. Think about cooking or slow walking, just very light physical activity, basically not sitting and being sedentary. The average American spends about 20 minutes a day of moderate physical activity. So this includes maybe walking fast or doing yoga or gardening, right? You're exerting yourself at a slightly higher heart rate. And less than 1 minute of vigorous physical activity per day on average, which is really kind of depressing when you think about it and how that compares to the recommendations of how physically active we should be to have optimal health. In sum, that's about less than 6 hours of movement on average per day. The rest of our time is spent sitting or sleeping, which brings me to sleep. I'm still on slide 4, actually, Wesley. Thank you. I have, I didn't go ahead yet. So I'm going to talk a moment about sleep, which brings me to sleep. So as a side note, I am not an expert in sleep, but I've always been super fascinated by sleep. I mean, have you ever really thought about sleep, right? We power down. We are extremely vulnerable during our time of sleep. And if you think about that from an evolutionary perspective, it's a very risky behavior for us to do. We have a whole room dedicated to it. And most of us would say we don't get great sleep, right? So it's easily influenced by the rest of our life. But anyway, I'm not a neuroscientist that focuses on sleep, but I've always been really interested in it. Prior to COVID, nearly 10% of Americans would have reported that they had diagnosable insomnia, or they would have clinically met the definition for having insomnia. And about a third reported feeling as if they consistently did not get enough sleep. So even in our normal conditions prior to COVID, we weren't getting great sleep. And we know that sleep quality and duration are strongly associated with psychological distress, which you can see where I'm going with this. And prior to COVID, the burden of mental illness, which is associated with sleep quality, was among the highest of all diseases. And mental disorders are among the most common causes of disability in this country. And they have a serious impact on physical health and are associated with the prevalence, progression, and outcomes of many chronic diseases, including heart disease. Many public health leaders have commented along with the pandemic of SARS-CoV-2, we have also experienced a pandemic of mental health distress during the last 2 years, which aligns nicely with the comments at the beginning of this session. So this background information, I just wanted to provide as a high-level overview as where we were mostly as a country and a community prior to the COVID-19 pandemic. And I'm going to speak a little bit more about how some of these key risk factors have been impacted over the last 2 years, and then move on to how employers and workplace settings can support employee well-being and resiliency. So slide 5, please. So if you think about the impact of COVID-19 on physical activity, it's probably not difficult for you to think back to your own experience and think about ways that you might have been impacted by this. I know that certainly my own lifestyle was impacted. We know that there were numerous challenges here, right? The country and worldwide, there were lockdowns and the only recommendation that the public health community could offer at that point in time was that social distancing and staying away from other people was the most important thing you could do to protect ourselves from COVID-19, which we knew was a huge health risk. And so that required that workplaces, schools, and gyms, and many other locations shut down and closed, and people were suddenly isolated to their homes. And this really put a limit on outdoor physical activity. And studies from across the world, and even with variations in policy and lockdowns, show that there was a huge decrease in the huge reductions in the amount of physical activity that individuals would have had. So there was a big change for most folks. And so we know that the reduction in physical activity, when we already had established that we're not very physically active, increases our risk for negative outcomes from COVID and from just other chronic diseases. How many of you have heard the phrase, sitting is the new smoking? I can't actually see you, so Leslie's nodding his head, but that's a very common thing to hear in the public health realm. You can jump to the next slide, please. Some very prominent physicians have made the comment that, in slightly hyperbolic terms, of course, but sitting is so bad for your health and wellness and longevity that you might as well be smoking, which is not really accurate, of course. But we've seen a huge movement in the workplace wellness industry towards standing desks. And some research estimates that we spend anywhere from 55 to 75% of our waking hours being sedentary. And that was pre-pandemic. So I'm going to talk a little bit about why sitting is so harmful for us, and then talk a little bit about how we can maybe disrupt some of those patterns, particularly in the workplace. So here's several reasons. There are 3 pathways I have laid out on the slide for you here about why sitting might be so harmful for us. First, when we're sitting, we're not doing the other activities that expend energy, right? This leads to fattening of our bodies, the increase of fat cell, the increase in the size of our fat cells and the increase of percentage of our body fat. And the reason that that is so dangerous is because it tends to accumulate in the more dangerous type of fat, which surrounds our organs. And that organ fat really promotes the process of inflammation, which increases our risk for heart disease. Secondly, sitting, not all sitting is relaxing, right? When I think of sitting, ideally we would be thinking of sitting along the beach or along the ocean and enjoying ourselves with like a nice beverage and a book or whatever's enjoying. But much of our sitting is not actually relaxing and enjoyable sitting. It can be stressful, right? If we think about demanding desk job, a challenging commute, a lot of our sitting, or if you're already ill in some way, then that sitting can be a stressful experience, which leads to the production of stress hormones, in particular cortisol, which also promotes the accumulation of organ fat, which supports the inflammation that I talked about momentarily ago. And third, the final reason is that prolonged inactive muscles lead to the release of chemicals and proteins in our bloodstream, which you can probably guess lead to inflammation. So what are we going to do, right? The nature of most of our work is to sit at a desk. I'm sitting at a desk right now and being largely sedentary. And most of the work that we do in this country is largely sedentary. So there's some good news. I don't want to leave you with all bad news. It turns out that frequent interruptions to prolonged sitting activate your bodily muscles and essentially extinguish that low, slow burn of inflammation in your body. So the key for you and for your workers is to promote frequent interruptions to sitting. So if you think about this during the COVID-19 era, having all of our meetings via Zoom, working from home, we have reduced the number of those short bursts of activity that get our muscles moving and lower the levels of inflammation in our body. And I think about this from my own experience. So I'm sitting at Des Moines University right now. The restroom is like 200 feet away from me, right? I have to get up and walk pretty far to go use the restroom. I have to walk to a different building if I want to go get a cup of coffee. And before COVID, I would have in-person meetings. So I'd have to walk to the other building. And my little activity monitor here would tell me I would easily get 30 minutes of activity a day just walking back and forth, doing my normal business in the workplace. Sitting at home, I can sit for a long time and no one's coming to knock on my door or invite me for a cup of coffee. And so I have to really challenge myself to create opportunities for those brief interruptions, those frequent brief interruptions that keep my body moving. And employers are in a powerful position to promote these relatively frequent but brief interruptions to sitting. Another piece of good news for employers is that when studies look at the associations between sedentary behavior and disease risk, they're usually looking at differences in leisure time physical activity. So while it is true that sitting all day at our job is not great for us, the truth is that what is more powerful is what your employees are doing in their mornings, in their afternoons and evenings, and on the weekends. And there are important and powerful ways that employers can promote additional activity during those leisure time, during those times of leisure that your employees might have. So it turns out sitting is not necessarily the new smoking, but if we are in a position to have frequent, brief interruptions to our sitting, that is better for us. Okay, slide 7. I'm going to talk a little bit about nutrition here again. So we all know, again, about eating healthy, that diet and nutrition have important effects on our immune system, our response to diseases, and our susceptibility to both chronic and communicable diseases. Dietary patterns and food access have been more closely examined during the COVID-19 pandemic because it is possible that some of the disparities we see in the impact of COVID-19 can really be looked at more closely when we think about access to healthy quality food, right? Public health professionals like to call this social determinants of health. And if you've not heard this phrase before, it basically indicates that your morbidity and mortality, your risk for chronic disease, and your risk for many communicable diseases is more strongly determined by your zip code than your genetic code. And so we really like to look at those things in public health and think about how can we help promote healthier communities by modifying things in the environment. And so that's a huge interest for most public health practitioners. But one of the possible explanations for why we've seen such disparities in the impact of COVID-19 among communities of color, among poorer communities, is possibly linked to issues with food security, the quality of dietary consumption, and many of those sort of systematic issues that were already there, and COVID just revealed the cracks in our system. In addition, misinformation about specific foods and herbs promising cure or prevention are potentially equally harmful if we are not really aware of and embracing evidence-based prevention efforts. So I'm going to tell you just like a brief story about my own experience here, which is there's a documentary on Netflix about essentially being vegan. Now, we all know that Netflix is pretty good about suggesting shows for us to watch, right? So I like to watch a lot of food documentaries. I love to cook. I like to watch documentaries about foods and other cultures. And so when I'm on my treadmill in the morning, this is the type of thing I watch. So Netflix suggests to me prior to this talk, oh, there's a new documentary about the association between diet and nutrition and your risk for chronic diseases. Perfect. I'm going to watch that. So I watched this and I'm immediately like, oh my gosh, like I'm doing everything wrong. Like I am not living my life the way I should be living my life. And essentially, the documentary presents a very powerful case about how consuming meat is linked to higher risk of chronic diseases. It presents a lot of information about the environmental risk and racial and ethnic disparities in the meat processing industry. It really did a very powerful job of aligning with things I already value, right? I already value climate change and the environment and animal welfare and eating healthy. So it really preyed upon things that I already value. And I was really sucked in. I was ready to tell my husband, like, all right, we have to be vegans now. Like, this is what we're going to do. Like, we're going to live longer and I'm going to make this change. But I started to think like, wow, I'm having kind of a powerful reaction to this documentary, right? Like maybe I should do some fact checking. After all, I'm a professor. I'm supposed to know this stuff. So I do some fact checking and find out that most of the claims are seriously exaggerated. The evidence that's presented in this documentary is cherry picked, of course, and it's designed to be delivered in a way that's really emotionally powerful for the audience. And so my point here is that we are all susceptible to misinformation. In the span of 24 hours, I was ready to make my husband get rid of a smoker and like, we're not eating meat anymore. We're going to have a plant-based diet. And I had to really check myself on some of those nutrition facts because it really did a powerful job of appealing to me. Netflix knows, I guess. So my point here is that none of us are really immune from this. And I'm happy that I fact checked it 24 hours later. And my family's happy about that too. So next, I think I'm ready to move on to the next slide. Okay, so I'm actually going to skip these 2 slides about sleep because I'm not going to have enough time. So skip this slide and skip the next slide. Basically, the impact of COVID-19 on sleep was variable, but for most people, it was not great. So we need to get back to reducing stress in our lives and having better sleep. So talking about mental health, I'm checking my time here. Numerous reports have documented that during the COVID-19 pandemic, there have been increases in a number of risk factors, including stress, anxiety, depression, and insomnia, right? Substance use and abuse have likely also increased as people have used those substances to cope with the unknowns and the risks. Indicators of stress and distress are also likely tied to occupational risk, right? So for some people, they didn't get to go home and work in their home office like I did. They didn't get to have that sense of safety and security. And healthcare workers in particular have been a large focus of thinking about occupational health. So how do organizational leaders start to think about building a healthier and more resilient workforce when the mental health of our communities and our employees is truly suffering? So I'm going to go now to the idea of wellness, the culture of wellness at work. The next slide, please. So there's a 2019 article that came out right before the pandemic that really talked about the 12 factors that support a culture of wellness in the workplace. And I know one of our other prior speakers spoke about wellness initiatives in the workplace, and I'm not going to talk about specific intervention strategies about how to promote wellness in the workplace, but rather how do you build a culture of wellness at your institution? And these are 12 factors that you can consider. And I'm not going to go through all of them, but certainly you'll have my slides and I can give you the reference for the peer-reviewed article, of course. But I wanted to highlight a couple in particular. The first is that there has to be a shared mission, vision, and values that strategies at your organization are built to support for the wellness of your organization. So I would ask you, is a culture of wellness built into your company's values? Are your values explicitly discussed at the beginning of meetings? Are they talked about when you're thinking about different decision points, how to spend money within your organization? If it is just the CEO of your organization talking about work-life balance, talking about mental health, and none of the other executive leaders are speaking about this, then you have a breakdown in your culture. And that's really a point where you have the opportunity to have influence. It's really important that there's effective leadership and management support throughout the organization, and that all of the leaders, even down to measly middle managers like me, are talking about the values of wellness, talking about mental health, and really focusing on that. Building a reward structure and recognitions within your organization is an effective way to help promote and build a healthier employee base. And there's been a lot of evidence-based ways in which we can do that some of our other speakers had spoken about. Building community and supporting ongoing grassroots efforts within your organization to build that culture of wellness. And it's not just physical wellness. We're talking about physical, mental, spiritual, all of the types of wellness that you can think of. If that is shared through these 12 strategies within your organization, then that can be really a powerful way for you to help build that within your company. Okay, next slide. The other piece I wanted to end on is thinking about, sometimes I think it can feel really a little hopeless. How do I, as a leader in an organization, really help my employees be healthier? Because there's only so much limit to what we can do, right? And so much of what our organization can do. So I really just wanted to end on speaking a little bit about resiliency. And resiliency is defined in the psychology literature as the dynamic process encompassing positive adaptations within the context of significant adversity. So when I talked about those social determinants of health earlier, a lot of those really rely on adverse events early in life. And there's nothing that we can do to as a workplace, as an employer, to mitigate those at this point. But what we can do is build resiliency for the ongoing and future adversities that we might face. And COVID-19 has presented a very powerful example of that. So adversity can be a single isolated high intensity event, or it can be lower level and high frequency. So ongoing chronic stress at work. And positive adaptation is where you help your employees come back to a state of well-being despite that adversity. And resilience has been thought of as an individual personality trait, as a capacity. So maybe today I have a lot of resiliency, but tomorrow I don't. Or it can be thought of as an ongoing process within your organization. And you can also think about building resiliency within individuals in your team or as a group trait. And so what you are likely wanting to do is build individual resiliency so that it supports a strong and resilient organization. And thinking about ways to do that is one recommendation of how I think you can build resiliency to support better heart health in the future. Next slide, please. So what factors promote resiliency for individuals and teams? One of the most important ways is social support from colleagues and supervisors. And again, this goes back to, this has to be part of your mission, vision, values throughout the organization. It cannot just be one key leader at the top leading this initiative, because if my supervisor is not supporting those initiatives, then that's what impacts my life more, right? So you need manager feedback and support throughout the process, and really building that into your culture and as a strong initiative. Positive relationships throughout the organization promote resiliency. So strong levels of communication and building opportunities for positive emotions within your teams. I tend to try to really make my team meetings as positive as possible. That just sort of stems from my personality. And I can tell sometimes that the people in my group are a little bit like, okay, come on, can we just get to the agenda? But it's something that I think is really important. And it's a way that we can all influence our teams, even if we're not in a position of leadership, is to build opportunities to facilitate positive emotions, because that will build team resiliency, which of course supports health and wellness and probably your bottom line. Next slide. So in conclusion, I think I'm about at my time. The COVID-19 pandemic presented a novel health threat that exacerbated already existing risk factors for heart disease in nearly every way. I think the point of most of my slides here is that the risk factors were already there. We were already not in a great place, and COVID-19 has really put a stress on the system. Both the public health system and the healthcare system have been seriously stressed by this experience. But employers do have a powerful opportunity. You can promote the health and wellness of the mind and body of your employees through multiple ways, big and small. You can promote a culture of wellness throughout your organization. I know that at Des Moines University, where I work, it is one of our core values, and it's all over the place. There's lunch and learns, there's a fitness center, there's health and wellness assessments each year. There's just a lot here that's built to support that. And in part of doing that, you can promote the individual and organizational resilience and health of your team members and your organization as a whole. And we know that healthier communities are happier and more productive. And so really the investment is quite worth it. And with that, I think I will conclude my remarks. Maybe I had one last slide. I'm not sure. Nope, that's all. Thank you very much.
Oh, thank you very much, Dr. Reimer. And as you shared, COVID-19 definitely revealed a lot of challenges, but it's definitely not going to slow us down. So we have to continue to kind of rethink and think outside of the box as we move forward. And I like how you shared that, sitting is not the new form of smoking, but we definitely need to do something about that. All right, welcome back. I hope everybody has got some blood flow moving around a little bit and ready for the next or second half of our presentation here. So before we introduce our final speaker, I want to tell you about some of the work that we're doing right here in Iowa. You probably know that the American Heart Association funds research, and that only the federal government invests more in heart and stroke research than we do. We're actually proud about that, but we're also conveners. Today, we have brought industry experts and each of you, leaders, influencers of health policies, at your companies together to reset wellness in the workplace. But we bring other groups together to address issues that have a huge impact on heart health. The pandemic has shown a light on many issues that our communities are facing. I know Dr. Reimer has touched on a few of those things, especially around food insecurity. But there is also But one of our basic and universal needs are humans is food, specifically healthy food. We saw demand at food banks grow since March of 2020. We found that our perception of people with food insecurity might not be as accurate as we thought. Before and during the pandemic, working adults can find themselves without enough money to feed their families. But not everyone knows this is a problem and that we can help. So we created a series of videos to showcase the ongoing need for nutrition security and outline the steps we can and are taking to bridge the gap for families. So the AHA is not doing this work alone. We are conveners and advocates, and we need buy-in and support from lawmakers and the community to make a difference. I'm going to show just 2 short videos here. You'll also see these on our Facebook page, but speaks to the work that we're playing in this space.
Our goal is to end food insecurity and not have hunger. And we're going to continue to provide food to folks who are in need. But ultimately, providing food to folks in need is not how we end hunger. We have to get to the root causes that are getting them in the situation that they need to seek out food assistance in the first place. We need to look at some of the policies that we've put in place that provide assistance for folks, so that we can get down to the core of why they're finding themselves in these situations in the first place.
Well, I think the American Heart Association's role has been because there are so many components to having, a heart-healthy life, that bringing all these partners together from various fields and sectors. I think that sometimes it's a challenge, is usually those, whether it's food insecurity, are generally talking to the food insecurity folks and not talking to what's happening in transportation, what's happening in housing, what's happening at the state advocacy level. So having partners at the state level or at broad umbrella like heart health, they're able to see the opportunities and connections that maybe others wouldn't.
American Heart Association and Urban Dreams teaming up. As we tell all the partner organizations, we've been right here on this corner since 1985, so we have trust in the community.
Eat Greater Des Moines has really been focused on bridging the gaps through partnerships and how do we build community through foods. It's not just up to food pantries and free meal sites and some of those I call traditional emergency food access points, where we've really learned, putting food where people are and making it simple for them to access is important. Double Up Food Bucks is a great example of really a combination of federal programs like SNAP, really supporting not only local grocery stores and local communities and local farms and our SNAP clients. Those kinds of programs give SNAP clients the opportunity and incentive to, when they spend those dollars on fresh fruits and vegetables, their budget goes farther, they still get the access, and then those dollars support local farmers, local grocery stores. Eat Greater.
So at the start of the new year, more than 80 Double Up Food Buck locations in Iowa closed because of the CARES Act funding that ran out. But the need persists. AHA is continuing to advocate to our leaders at the state and federal level, as Aubrey has touched on in his video, to secure funding for healthy food access. So if you're not already part of the You're the Cure, which is our grassroots network of advocates, You can easily join today by texting IA 46839. So now I would like to introduce our final speaker, Heather Gavris. Heather currently serves as the Portfolio Advisor for Nutrition and Wellbeing at the American Heart Association. She is responsible for the expansion of the Healthy for Life Community Nutrition Program through cultivating national and regional strategic alliances, development of consumer nutrition content, and supports the association's workforce well-being initiative, working closely with field staff across the country. Throughout her career with the American Heart Association, she's held a range of positions building on her experience in public health, nutrition education, and community planning. After completing her Bachelor of Science in Consumer Health Sciences from Miami University of Ohio, a dietetic internship at Hines VA Medical Center, she began her career as a clinical dietitian at the Cincinnati VA Medical Center. She also holds a Master's of Public Health with a focus on health promotion and is a member of the American Public Health Association and Academy of Nutrition and Dietetics. Heather is going to share how the American Heart Association can better support your organization and employees. So please welcome my dear friend, Heather, to the screen here.
Well, thank you, Wesley. I appreciate the very kind introduction, and it was great to hear Dr. Reimer's comments related to the impact of COVID-19 and how it has influenced or not influenced certain behaviors for both employees as well as employers. I imagine that you might recall that COVID-19 has had an impact on all of us, including from the American Heart Association's perspective. We have really had to revisit our thinking around workforce well-being and have had to make it a bit more relevant to the current environment and current needs. So I'm really delighted to be able to give you a sneak peek at some of those forthcoming resources that will really help you create that culture of health and well-being within your organization. So way of introduction, if you could go to the next slide. As you probably heard, I started out my career as a clinical dietitian. And in that role, I had worked with a number of patients, counseling patients who are managing chronic diseases, managing diabetes, recovering from bypass surgery. And while I recognized that that was really important work, I also was really drawn to the prevention of cardiovascular health when I joined the American Heart Association. As my career continued to evolve, not only did I recognize the importance of health promotion, but I also really recognized that how policies and systems and environments were shifting and shaping our behaviors. And so, I had the opportunity to really spend about a decade of my career focused around stroke systems of care, and cardiac arrest systems of care. But my true passion, in all honesty, was around the preventive side of cardiovascular health. And, really being able to apply that systems thinking to work that would really help improve the lives of everyone. And whether that's through organizational change, policy change. And so I'm really delighted to share with you not only the new science that's driving our vision, but also the new resources that will be forthcoming as part of our new workforce well-being initiative. So as part of our reshaping, we've had to create a new vision. And so if you go to the next slide, I just want to briefly mention what that vision statement is, and then kind of provide a little context as to why we chose particular words. So that vision is around empowering organizations everywhere to create a culture of health and well-being so that all people live healthier lives. And so when we think about empowering, it's about providing thought leaders with relevant, timely, science-based resources and in a way to empower them and their respective roles, again, to build that culture of health and well-being. And the word well-being is intentional because, as you'll learn, our new science is really looking at a more holistic approach around health and looking at this mind-body health connection. And of course, we want, to improve the lives of everyone across the world. And so when you think about employers and organizations, that is a great channel in which to help influence individuals, shape those behaviors, and address different factors that not only improve their own individual health, but ultimately will help the organization in terms of building their culture of health and well-being. So if you go to the next slide, I just want to recognize that we know it's been a challenging years, I should say, and will continue to be a challenging landscape. It was challenging even before the start of the pandemic. And then as a result of COVID-19, employers across the country and the world have really had to, make the pivot to having their workforce go remote or being in a hybrid work environment. Certainly, there's been the uncertainties of various variants, whether it's the Delta variant, the Omicron variant. Certainly, there's been the impact across the country in terms of requirements or health mandates. And then lastly, we've seen a mass resignation. And these are key, stressors for employers and, thought leaders of employers. And as I mentioned, we're not out of those uncertain times. And we will continue to recognize that the challenges that our employers are facing across the country. So as part of recognizing the fact that it's been difficult, we know it's affected the heart of every organization. And certainly some of the statistics that are mentioned here really align with the comments that Dr. Reimer had shared previously. People are struggling with their mental health and mental well-being. There's been a fourfold increase during the pandemic in terms of anxiety and depression symptoms. For those individuals who have gone back to work, it's not been easy. 30% of individuals have indicated that it has an impact on their mental well-being. They still feel disconnected. They're not getting into their same routine. And those of us who are still working remotely feel that social isolation, as well, even though employers are still trying to, figure out how best to accommodate remote workers in terms of being inclusive. And then lastly, we have seen the turnover across industries just at a record high. Based on the latest survey that we have looked at, it's about 40% of employees that are looking to shift their job or job opportunity within the next year. And so these, again, are sort of the key stressors that we recognize are impacting every organization across our country, across the world. And we needed to really shift our thinking about how do we provide readily available science-based resources that are really touching on these particular stressors. If you go to the next slide, I just want to mention that we are a science-based organization. Everything the American Heart Association does is grounded in science. Our science really propels our priorities. It propels our strategies. And, in particular, I want to highlight one piece of science. We came out with a new scientific statement in February of 2021 that really looked at this connectiveness between mental well-being and health. And so, we all know, some stress is good. It can, help you continue to be motivated, be productive. But when you think about the impact of chronic stress, that has some significant impact in terms of someone's overall health. So in this particular piece of scientific statement, again, recognition that there is this mind, heart, body effect, which can be positive or it can be negative. And again, high levels of chronic stress are linked to heart disease and stroke. So by improving our mental well-being, again, can have that positive impact on overall health, including cardiovascular health. So if you go to looking at the next slide, I just really want to overemphasize that your organization is only as healthy as your work culture. I know Dr. Reimer outlined sort of 12 elements that you could consider in terms of really helping to build that culture of health. And the American Heart Association, we're a trusted authority. We have released scientific statements around the comprehensiveness elements of workforce well-being programs. And we will be continuing to release science that really supports the need and validation of workforce well-being efforts. And again, we are there to be your partner, to be along your side in that journey. So again, I'm really delighted to be able to share with you some of the new resources that are under development. So if you go to the next slide, I think we also want to recognize that we don't necessarily see, there's a great desire to return to normal. Things weren't really great before the epidemic. People were struggling and managing, not only their physical health, but their mental well-being. There certainly had been health disparities that were very prevalent and continue to be prevalent. But as we've seen as a result of the pandemic, employees are asking for more, and they're asking for more from employers. They want that more autonomy. They're looking for better work-life balance, and they are looking for their employer to provide those environmental supports about mental well-being. Again, that's all with the intent of helping those employees to thrive, whether it's around the development of healthy habits, helping them to build resiliency, and also building a sense of inclusiveness. So from the American Heart Association's perspective, we don't want to go back to normal. We need to meet organizations where they are and what employees are asking for today in order to really help, build that culture of health and well-being within your respective organizations. So I am going to give you a sneak peek, and I keep saying that, as to what some of those resources are that are going to be forthcoming. And I recognize that some of the organizations that might be joining today have been engaged with the American Heart Association, and that is great. And we would welcome that continual engagement, is continuing. And I think what you'll hear in just a moment is, the resources that we've tweaked and sort of will be adding will just continue to enhance those opportunities that you already have in place. So if you can kind of skip to the next slide, we can go to the next one, Wesley, if that's okay. What we've done is, again, looking at all the science around what, elements are part of an effective workforce health and well-being program, and really use that science to better develop a very holistic approach that includes mental health. Again, looking back at the science statement that was released in February 2021, we really want to make sure that there is this emphasis on the mind-body-heart connection. So based on that science, as well as the science that looks at the comprehensive elements that need to be part of a workforce well-being program, we have created not only credible, but actionable guidance that will be available to you in the near future. We will also provide evidence-based best practices as part of the tools that we have created. I will mention in a moment that part of the tools that we have redeveloped and reimagined have actually had an opportunity to go through some user testing and some feedback. And again, this is based on feedback that we've heard from employers across the country that have been engaged with us in the Workplace Health Achievement Index. So if you want to advance to the next slide, I'm going to talk about some of those new components. And again, we are your partner around employee health and well-being. So where does that start? So it's about getting your insights. And so those of you who have been familiar with the previous Workplace Health Achievement Index, we have reimagined that assessment tool, which will be called the Workforce Wellbeing Scorecard. This is an opportunity for you to evaluate the comprehensiveness of your workforce well-being efforts and that are aligned with those best practices. And through that assessment tool, you will be able to get an analysis. So where do where are those gaps? Where are those opportunities? And so those benchmarking reports that I'll mention a little bit more detail in a moment, that will really guide those opportunities to build that culture of health. So again, the assessment tool being the scorecard, getting sort of that analysis through the comprehensive reports that you'll gain from the scorecard. And again, one of the new components is really building out an employer resource center. That employer resource center is, I'll speak about it in a moment, but it is going to provide you with the actionable, readily available guidance that you have been asking for. So that these are resources that you can use to build that culture of health and well-being within your respective organization. And then lastly, is providing recognition. And I'll talk a little bit more about the new recognition framework that we've developed that aligns with the new scorecard, as well as some of the new components that's associated with the new recognition program. So if you want to go to the next slide, Wesley, again, these resources are to help your team. So very similar to the opportunities that Dr. Reimer mentioned. So building healthier habits, maybe that's around providing, healthier food and beverage options. Maybe it's looking at, opportunities to increase your physical activity because of the, sedentary, jobs, reducing tobacco use. But it's also about optimizing mental well-being, increasing resiliency, really giving you as an organization the resources that you need to address the mental well-being challenges, and also to help reduce the stigma and beginning to talk about that in the workplace. And then lastly, if not most important, is it about achieving equity? How do we identify those gaps and opportunities to create a more inclusive workforce? And then obviously that's going to lead to building a better culture of health. So I am going to speak briefly about some of the new resources that'll be part of the resource centers. So think of that resource center as your one-stop shop. So these are really where all the tools that you might need to access. Looking at, staying up to date, how to save time. We recognize employers are challenged. They have very limited time. Learning from peers, and then of course, making it happen. So when you think about staying up to date, it is around providing, an opportunity to hear from other thought leaders. Maybe that's going to be through on-demand podcasts. Maybe it's going to be looking at key trends that are impacting human resources and providing an analysis of that. Keeping up to date with sort of the sentiments of our US workforce. Saving time, this is a really important piece when we think about helping employers improve the workforce health. Pre-written policies that align back with those evidence-based best practices that I'll mention in just a moment. Providing that detailed guidance around, what's really pressing the workforce and HR in particular, and then also continuing to provide those ready-made resources. These would be ready-made resources that you as an employer could automatically share with your employees. Again, really focused around the various health behaviors that we're trying to influence, many of which Dr. Reimer mentioned already. The other element of this resource center is around learning from peers. We have heard, many times that there is a lot of value and benefit in having these local and or national virtual networking opportunities, sort of like what we're doing today. But we'll continue to do more of those virtual networking opportunities, more on a national scope. Developing case studies from peer-like organizations. And these case studies would be across industry sizes, across industry types. And lastly, is really allowing you to learn and exchange those best practices amongst yourselves and your peers. So again, creating that network and facilitating that exchange amongst your peer is going to be a critical piece of this resource center coming in the near future. Again, the intent of all these tools is to really help you lead and being able to keep that quality improvement process going, building out that roadmap for the culture of health and well-being specific to your organization, all with that intent of improving the health and well-being of your employees and your workforce and the culture of health. So I'm going to shift briefly. I just want to mention around our recognition. Again, those of you who have been involved with our Workplace Health Achievement Index, we have provided recognition opportunities associated with that, and we will continue to do that. But the good news is we are looking to elevate that visibility for your organization if you are in fact recognized for that excellence. So we are in the process of confirming a media partner, whether it be Forbes, Fortune, or LinkedIn, that will help elevate that visibility for your organization and being recognized for the great work that you're doing. So there definitely will be more to come in terms of the recognition, and I'll speak briefly in just a moment about that new recognition framework that's aligned with the scorecard. So shifting gears, I do want to talk about the Workforce Wellbeing Scorecard and talk about some of the new components. And you'll get a sense of some of this in just a moment. So some of the new elements are, one, it's on a new technology platform that has an improved user experience. And we have had testers internally and externally provide feedback in the development process of this scorecard. And we'll continue to do that after it's actually released, so that is part of our continuous quality improvement process. We have also updated the recognition levels, which I will mention in just a moment. Part of the redevelopment of this assessment tool was ensuring that it was aligned with the current evidence-based best practices. So that means questions were added around the health and well-being of the whole person. So obviously questions around mental health, financial well-being, really looking at drivers around the mental well-being and physical, not only the physical health, but mental well-being of one. But we've also added a category, which we'll speak about in a minute, about integrating that health equity lens into the workforce and really looking at those evidence-based best practices. The weighting of the scorecard and the sections within the scorecard has shifted, and you'll get to see some of that in just a moment. Lastly, I know it's not mentioned here, but we will have a new deadline with the scorecard. Those of you who've been participating in the index sort of recall that we've had a June 30th deadline. We are looking at a fall deadline going forward. So more to come on that. So if you want to advance to the next slide, I know this may be difficult, but I just wanted to give you a sense of the new visual layout and sort of that user experience. Hopefully you can tell, if you're familiar with the index, that it has a much more visually appealing feel to it, and the ability to navigate that the scorecard has definitely been improved. So once it's released, you'll certainly have that opportunity to take a closer look at the scorecard, and certainly we'd be open to your feedback as well. So the culture of health questions have slightly changed. It's a little longer. It's a total of 82 questions, and it's across 9 categories, because we wanted to ensure that we were representing those questions aligned with the science. Again, there have been questions added under organizational policies and environment, specifically about mental health, financial health. We've added some questions in the programs and interventions to, again, align with that more holistic view of one's health. And as I previously mentioned, we added a new category around health equity. And that's all around the best practices and strategies to drive and influence health equity in the workforce. You may notice at the bottom, we added a COVID-19 category. Now, just to keep in mind, those questions are not scored. They are really just there. They may change over time based as the environment externally changes. But we just felt it was very relevant at this current stage as we are looking at this new scorecard in the near future. Now, to the next, talking about scoring and weighting, it has significant change. You can see that 92% of the points that are allocated are really what we would call our structure and process measures. So again, what are those best practices in each of those categories? So that accounts for 92% of the scorecard and the points that are allocated to the scorecard. The remaining 8% is really for performance measures that are tied to aggregate employee health data. So if you're familiar with the Workplace Health Achievement Index, you may recall it was a 60-40% split. So again, significantly different based on feedback and really looking at ensuring that it was equitable across all business sizes when we looked at redeveloping the scorecard. The other element I will tell you with the scorecard is that it has gone through a validation process. There's actually a science paper, I'd be more than happy to share it, but it's some work that we did with Johns Hopkins University that really validated the questions that are currently included in the new scorecard. And then that's on top of the fact that we have a national workforce health advisory committee that is made up of experts, not only in workforce health, but behavioral health. And so they also certainly looked at the science behind this new scorecard and the questions and the weighting. But I do want to, I mean, this is a pretty significant shift from where we have been in the past to what's going to be available going forward with the scorecard. If you go, so recognition. So we have modified our recognition levels. The good news is we've added a category. We've added platinum. So for those organizations that may have been at that gold level for multiple years, we've added an additional recognition level, which is platinum. So in order to even be eligible for that platinum recognition, the organization must have provided employee health data, which I'll mention on the next slide. But again, we're super excited, not only about the new recognition levels, but the fact that we are in that process of securing that media partner to help elevate the visibility that's associated with that recognition. And again, we will continue to provide similar recognition tools that we have in the past, digital resources that employers can use to really elevate their visibility locally. So when it comes to employee health data and reporting, there's a couple different options that will be part of that scorecard. Organizations can continue to use My Life Check, which is a free assessment tool. If an organization already does health risk assessments and they're gathering the similar data that aligns with what we call our Life Simple 7, which are these 7 health behaviors and health metrics, again, they would have that opportunity to use that aggregate employee health data. The good news, those of you who've been familiar, it was a separate CSV file that you had to upload into the platform. It was kind of wonky, not the most user-friendly, I'll be honest. So going forward, that data entry process is actually embedded within the new scorecard application. So that's a good improvement. Still, you'll still have the opportunities to receive dashboard reports, again, benchmarking, not only against similar size, but similar industry type, as well as the revenue that's generated. So those are the 3 criteria that we've identified for these benchmarking reports. And then you'll still have a benchmarking report around the employee health data. I lastly, just kind of wrapping up, want to just mention the resources that I just described, they are developed by not only our science, but also our industry leaders. If you're not familiar, we established our CEO Roundtable in 2013. It represents roughly 45 Fortune 100 companies and their respective leaders. But they have really been working alongside us in terms of not only testing, but providing that feedback as we are wanting to develop really effective tools and resources to help everybody. And that really helps us kind of scale these evidence-based best standards and best practices. Just want to wrap up. We all deserve to have that healthy and happy environment when we're at work, and certainly a culture that's created by our individual behaviors. It's also supported by that proactive leadership, which is again a point that Dr. Reimer mentioned in terms of what's really core. I'm not sure if you recall, but when I should have mentioned sort of the elements that are part of these best practices, but leadership is critically important in terms of driving the opportunities to build that culture of health. Small changes can certainly make a big difference. And we have seen that through the evolution of the Workplace Health Achievement Index, and we'll certainly see that as we roll out our new resources. So with that, I would just want to say thank you. I hope that gives you kind of a sneak peek as what to come. Certainly stay connected with us. Certainly, if you do want more information, you can reach out to us at workforcesupport@heart.org. But you also have a great resource there in Des Moines with Wesley. And with that, I just want to thank everybody.
All right. Well, thank you very much, Heather. And I really hope that our attendees and the organizations that are represented on our call today really take full advantage of our new AHA wellness platform. I think that's going to be a great way for companies, once that is ready to go into action, really to start the year right. We did have one quick question that popped up from the chat box here, and I think you addressed it regarding the well-being scorecard. Is it easier to fill out, and does it take less time? That was one of the two big questions that popped up.
Yeah, that's a great question. I did just glance at that, but yes, it will be easier to complete. It is on a new technology platform. We've gone through some user feedback to make it continuing to be as seamless. In terms of time, it will take less time in terms of being able to complete it because of this new interface. And certainly as this rolls out and there are continual questions, certainly we will be there as a resource for you.
Perfect. Well, thank you very much, Heather. And once again, thank you very much for your time. And I know you're going to be a really great resource once those things start to roll out. We'll be working with you hand and foot here and looking forward to getting companies on board. So thank you very much for your time today.
You're welcome.
Good deal. As we're kind of wrapping some things up here for today, I really hope that you all walk away with some inspiration, some new tools to make a difference for your employees' health and happiness. We know together it's going to build a culture of health on all of our workplaces. So to that end, there are ways for you to continue to stay engaged with the American Heart Association and achieving our mission of extending lives. So you can connect with us online at www.heart.org/Des Moines for our live chats, our supportive patients, to support our patients, our caregivers, on just how to stay healthy. You can stay up to date with our local activities on all of our social media channels. You can find us on all platforms at AHA Iowa. And for additional resources on eating healthy, being physically active, managing stress, things that we've touched on throughout their entire presentation, even from January 19th, please visit www.heart.org. And one important thing, and to mark your calendars, please mark your calendars for these important dates, is National Wear Red Day, which is this Friday, February 4th, which is a great way to show your spirit for Heart Month. And on April 30th at the Iowa State Capitol, please join us for Heart Walk. We are thrilled and blessed to have Jonathan Kester, president of the Kester Development, to serve as our event chair. So this is just another great way to get your employees out and about, participate in a fun activity that supports a great cause for heart health. And you can simply register your team today by visiting www.dsmheartwalk.org. Once again, thank you again to all of our presenters going from January 19th up to part 2 of today with Dr. Rachel Reimer and Dr. Heather Gavris. Very thankful for your guys' insight for this year's Wellness Reset Symposium. And finally, thank you to each of you for your commitment to build our culture of health in the workplace and throughout Iowa. It truly is a testament to your desire for continuous improvement and workforce health that you're all here today. So that being said, a link to the presentation will be available to all of you on our social media pages later next week. And to that end, thank you, and we hope to see you again next year. Thank you, and please be safe.